Only a couple of weeks ago I had a patient come in that had a fist-sized mass in the central part of their chest. They were young, they were in their 30s, unaware of the diagnostic possibilities. They were obviously very anxious and they needed treatment very quickly.
For patients, the most stressful part about going through the testing process is not knowing the results, the fear of the unknown, not being able to plan for the future.
For someone who has cancer or who thinks they might have cancer, waiting every day for a diagnosis can seem like an eternity. The Diagnostic Assessment Program here at Southlake, which is an initiative that's supported by Cancer Care Ontario, really helps to shorten the wait time for patients in order to reach that diagnosis. It allows for coordination of care, scheduling of appointments and consultations. It provides timely access to information and support for patients, and really helps to coordinate the communication between healthcare providers so that the patient's care is really at the center of what we're trying to accomplish.
CCO's goal, overall provincially, is from time of referral to time of diagnosis for our lung cancer population. 65% of patients will have that diagnosis or rule out within 28 days.
As part of the Regional Cancer Program Network at Cancer Care Ontario, we all measure our performance against quality metrics. It's a real key mandate for Cancer Care Ontario to make sure that we're meeting the needs of our patients.
At Southlake, we always ask, how can we do better? When we started this project, we were about 47% within 28 days. Not great, and not even at the provincial average of 58% or the target of 65%. We knew we needed to do better, we could do better, and we can do better.
So it provided a unique opportunity for us to conduct an examination of why we weren't performing so well, and so we really looked to improve the performance, to improve the care to our patients. We brought together a group of individuals into a room to talk about, not about who was to blame, but what was the problem and how could we fix it? And the idea was, let's concentrate on the opportunity to find a viable solution.
We came together in a room and mapped out the whole process. We had representation from patients as well. We felt that it was important to hear directly from them.
We used the lean methodology, and in extreme detail, we mapped out every step in the process. We then looked at parts of the process that actually caused a delay for the patient. We then looked at how we could remove or eliminate the waste altogether.
As soon as people hear what the possibility is, then they're relieved how quickly things are moving.
So after all of the lean that we've done, so far our result is 75%, so we're exceeding the provincial target and we're #1 in the province. Early days, and our goal now is to continue to use the data and look at the data so that we make sure we sustain these improvements.
In the end, it showed a 60% improvement in our overall performance.
That translates directly to better patient care.
The most important thing is really reflecting on the patient experience and individualizing the care and expediting the care wherever you can. It really makes a difference for the patients and their families.